Dr. Yeaman, as we can imagine, you've got your hands full right now with the COVID-19 virus. And what sort of strain is that really right now putting on the healthcare system?
Right now the challenge at this moment is around testing. It's hard to measure what you can't test for. And so the number of people that are infected is difficult to tell. We're trying to screen people at the offices. Have you done international travel? But the reality of it is that that virus is, you know, akin to the common cold in terms of its ability to spread rapidly, although its impact on the elderly in particular is much more profound. So, as healthcare providers, one, we have to be able to protect our patients and our facilities from being infected. So that's the first challenge. And then obviously the second challenge is those that do have the more serious version of the illness, how are we going to adjust our capacity and triage patients in an appropriate way that those who can be at home are at home, so that we're using our inpatient beds in a way that's um, effective for those that are the most ill. So the triaging of this is going to be tremendous. And that's, again, I think one of the ways that CommonWell is so vitally important. You know, a lot of hospitals, I think, in the near future are going to be on divert because their beds are going to be full. So patients are going to wind up in different areas that they wouldn't commonly go to. So how are we going to do that in an effective way to make sure that we're delivering the patient's care? And one of the most important things about coronavirus that we're currently seeing is the comorbidities that these folks have. So if you have diabetes, or if you have underlying lung disease, if you have an autoimmune disease, how are you going to take care of those folks and understand their risk factors in order to risk stratify and obviously triage them and prepare for the appropriate level of care for that patient? You've got to have information to do that. So again, we need interoperability and record sharing in order to accomplish that. And I think CommonWell is a big piece of that. And then what we do at ADVault obviously is a huge piece of that as well in terms of advanced care planning. And one thing I like to say about advanced care planning is this isn't all about death and dying. This is really critically important in terms of having a patient's plan known. So anytime you take a trip, you have a destination, and life's a journey. And we know that there's a destination at the end of life. And so being prepared for that is an important thing for all of us. And it's a critical thing to help families preserve their relationships, because we know many times at the end of life, it's miscommunications and misunderstandings and or disputes over what mom or dad would have wanted that ultimately lead to a lot of distress within families and quite frankly, tear families apart. So again, creating this information, sharing this information, having it available when it's needed, because most of our events aren't planned. And in particular for the elderly at this moment, I think that this is, a really key thing that people need to understand. Having your record shared, using CommonWell, knowing that your records right now couldn't be more important, because where you're going to receive care is really yet to be determined. And we're going to have to be pliable and flexible in how we deliver care as a healthcare entity and system for the United States. And having your advanced care plan is a big part of that as well.